So how are you guys doing?
Good.
Good?
Good.
So we're going to talk a little bit about something that, this time of the year, it becomes more and more important, so to say. Because there's so many people, when it's dark and dreary, cold, it just get depressing in itself. So it'd be good to, it's a good time to talk about it. And it's something that you can easily correct, and it's easily, if you do some nutritional steps and kind of know how to control it. There are a lot of things that can be done. So before I start, I always want to kind of find out a little bit about what it is that you guys are, why you're here. I mean, obviously it's about depression, anxiety, but just want to kind of hear like just a couple of sentences, what you're looking for, and that'd be great. So, you want to start in the back?
Well, I have a husband at home that this weather really affects, so I'm hoping to get something out of it to help,
Wonderful.
Yeah.
Wonderful. Yes. And that?
The weather tends to drag my mood sometimes if I allow it.
Yeah.
The overcast, the dreary, and also being in treatment for the hormones that I'm going through.
Yeah.
Can also affect the level of anxiety.
Yeah.
But I'm doing much better.
Wonderful.
Doing much better.
Wonderful. Okay. Christian?
Seasonal things as well.
Yeah.
I really notice it.
Yeah, exactly. Yeah. I'm going to see sunshine in a few days.
Yeah.
So I'm really excited.
We're here more for our daughter. We have a 16-year-old who's really starting to have some anxiety issues, kind of going through cycles of period of about a week and a half or so, be really anxious and or depressed, and so we're just trying to see if there's some nutritional wise we can do to turn that around for her.
Okay, good. Perfect. So perfect. Okay.
Just trying to learn more about the topics, and
Yeah.
I think anxiety affects so many people, and I think it's a part of everyone.
Yeah.
And especially learning how the sugar affects anxiety, and so that's where our interest came in.
Okay, good. Ryan?
I, as well as several other people I know, seem to be waking up at 3, 4 in the morning on a regular basis, and I figured, it's probably anxiety, so I'll come in and see what I can find out about this topic.
What's going on? Yes, as Carrie was saying, I mean, one of the biggest things when you're dealing with anxiety or depression, first thing that you always need to know is that mood goes with blood sugar. If the blood sugar goes up and down, mood is going to go up and down. If the blood sugar is crashing, mood is going to crash. And whether that manifests itself as anxiety or depression, either way. Mood is going, it follows along with the blood sugar. So what does that mean? I mean, what do you do practically about that? Well, obviously, in order to be able to regulate the blood sugar, you want to eat food, you want to eat in such a way so that your blood sugar then stays at an even keel for as long as possible. And with that, then you need to then avoid foods that create these sugar spikes. And what foods are they? Carrie?
Processed foods with lots of sugar and junk food.
Yeah, things that what you would call have a high glycemic index. So things like
high fructose.
Corn high fructose corn syrup. You have just simple refined sugar. You have any kind of refined wheat flour, and any kind of refined grain will create these sugar spikes. The way you measure glycemic index, it's pretty much based on a number of things. It is a measurement of how quickly sugar enters into the bloodstream after you eat food. And there are certain things that can then slow down that process. One is if it has a lot of fiber in it. That will then slow down the release of sugar. Also, if it has a lot of good fats in it, will slow down the release of sugar, or a lot of protein in it. Also, what type of sugar will have an impact. Let's say, glucose is a sugar that it ultimately gets converted to in the bloodstream. That is what our brain will use. So if it is something that just supplies direct glucose, then that will then instantly just jump into the bloodstream. But they've seen also like high fructose corn syrup will do exactly the same. It will bypass the liver and just get into the bloodstream, and you'll just see your blood sugar just skyrocket. So, so you want to eat then foods then that has good protein in it, has lots of fiber in it, and also has good fats in it. And that will then slow down that release of the sugar so you don't create that spike. And then when you have that spike, you will then have the body responds to that spike then by producing a lot of insulin. And that insulin is then to transport that sugar then into the different cells in the body. And however, the insulin is longer acting than what that sugar spike is. So that will create then a crash, the sugar crash. And that's when you then feel anxious, depressed, the adrenals kick in, you get into that fight or flight mode. And that is when, especially then for teenagers or for anyone, but teenagers tend to think that they can eat anything and then be okay, and that might have been okay when they were younger, but then when you're dealing also then with the hormonal stress that takes place, like your daughter then starting cycling, and you have that hormonal stress. And then when you add that additional stress with this blood sugar roller coaster, then that is really then going to be hard to be level emotionally. So, so one key then when you're eating, then obviously what type of food are you eating, but then also make sure you don't go without food for a long period of time. So if you're dealing with depression, anxiety, you pretty much want to make sure that every 2 to 3 hours you eat something, and it would be good to have some kind of protein or something. It can be like a little peanut butter with a celery stick, or just something, some kind of protein is fantastic. So the one gland that helps to regulate then the blood sugar then in between you eat are the adrenals. And the adrenals then also deal with our ability to handle stress. So if we are under a lot of stress, then the adrenals obviously is going to deal with that, and then it has a harder time to regulate the blood sugar. So, and again, if it has a hard time regulating the blood sugar, then again mood goes along with blood sugar. So you're not going to be able to to be happy if your adrenals are dealing with the stress and can't handle both. And then you get then a third factor, which is then if a woman, for instance, is cycling, then they get that additional stress, or that hormonal stress that's taking place. Or for a man, when all these hormonal changes take place, then you get that additional stress. Or when you then start to get a little bit older, and you start to lose a lot of that hormonal support. You get less testosterone or less female hormonal substances. Then you have less of that support, and then you have also less ability then to regulate the blood sugar. So the key is then to make sure that you then control then the level of stress that you have around you. You also eat low glycemic foods. You eat every 2 to 3 hours, and so that will then handle that area. Another part that they've seen that plays a key role when you're dealing with depression, anxiety, is actually the thyroid. Does anyone know what the thyroid does? Christian? Since you were hiding over there.
I remember from last time. I don't remember the specifics.
That's okay.
Regulates something.
Yeah, you're good.
Temperature doesn't regulate your temperature.
It regulates your temperature. And what else does it do?
I'm trying to think. I've read this 100 times, and I don't remember.
No, that's okay.
So temperature.
Mhm.
I can't think of anything else.
Controls the metabolism.
What's that?
Controls the metabolism.
Metabolism, exactly. So it actually then controls energy production within the cell. So if you have low energy, it's hard to be happy. So thyroid is a vital function, and there's so many people that are dealing with thyroid dysfunctions. And thyroid dysfunction can be connected to a number of different things. A common thing is a deficiency in the mineral iodine. And that's probably, out of the 5 minerals that most people are deficient in, iodine is among those 5. Also along with zinc, which also is important in this aspect. So iodine is then crucial in order to be able to support the thyroid function. I'm actually going to be using the board, which I always put it up here and then I forget to use it. Let's see if I have the markers. So you have so you have the different glands. You have then thyroid, and you have adrenals. Those two are the energy producing glands of the body. And your brain continually needs energy. So if it's not getting enough energy, then that's going to affect your mood. Thyroid, as I said, it works very much on the metabolism, and also is very dependent on the level of iodine. But it also requires other things, like lithium orotate is something that has a very protective effect then on the thyroid. Or selenium. There's 2 different forms of the thyroid hormone. You have what's called T3 and also T4. T4 is the inactive form of the thyroid, and T3 is the active form. So in order for T4 to be converted into T3, it needs selenium. So if you're deficient in selenium, that conversion is not going to take place properly. So for thyroid health, you have then, this is an iodine, and then you have then selenium, and in some cases also then lithium orotate. And a lot of times what happens, what I see with patients, is that their thyroid is it's kind of like it's exhausted, so you feel exhausted and then all of a sudden kick in and then you're anxious, and then it slows down and then you're depressed, and then it kicks in again and you're exhausted, or you get anxious. And lithium orotate is the one that helps to kind of calm down that thyroid so it doesn't just start spinning quickly. You know, which happens a lot when you're exhausted all day and then all of a sudden you go to bed and then your mind just goes. Because the thyroid didn't have the energy to deal with what was going on during the day. So it was just dragging, and then all of a sudden when you lay down, then finally it feels like it can accomplish. So it's been trying to push, you know, all day long, it kind of get going. And now when you're laying down, then it just kicks in and it just spins. And then your mind goes and you get anxious and you can't sleep, and then obviously the next day you're exhausted again. So lithium orotate is probably the thing that helps them to protect the thyroid then from that to take place. So thyroid is crucial, but also thyroid is very much affected by different chemicals that you're exposed to. And also it's affected also by food sensitivities. So if you eat food that the body has a hard time dealing with, that's inflammatory in nature, that will also affect the thyroid and also will affect the adrenals. Adrenals, as I said, they are your fight, the ones that are dealing with stress. And if you're dealing with a lot of stress, then they get exhausted. These two are the two energy producing glands. So when the adrenals get exhausted, the thyroid has to take over. And that one then has to work harder, and then after a while it starts to crash also. So in order to be able to feel good emotionally, these two it's crucial that they function optimally. So in order to support the thyroid, you have these things, and then for the adrenals, obviously it's important then that you relax and you control then your environment, so that, I mean, you remove then the different stress factors, and you can use different meditations, like a breathing meditation. Try to relax for 5 minutes in the morning before work starts, and that's very, very important to do. Also then you have certain herbs that can be very useful when you're dealing with adrenal stress. One herb that is fantastic, especially when you're dealing with anxiety, is passion flower. It's one of my favorite herbs when you're dealing with any kind of anxiety, and you can't overdo on it. Meaning, if you're dealing with kind of anxious moment, you can take like 30 drops of it, and then if you're not doing better in like half an hour, take another 30 drops, and then you can just do that until you feel okay. So, and I've seen people actually do much better on the passion flower than taking things like Xanax. Yeah, so it's a fantastic herb, very safe, and it does a really, really good job. So also additional herbs that are great then in just replenishing and regenerating the adrenals. You have things like licorice is a great herb for that. Also you have Schisandra is another great herb. But then also you have something called ashwagandha. And what's great with ashwagandha is that it actually helps to support both the adrenals and the thyroid. So,
what was the other one you said before ashwagandha?
Schisandra, Schizandra.
Now, if we're seeing you and we're getting stuff for our adrenals and thyroids, is this something we should take in addition to what?
No. So then I'll continually monitor that and see what you're needing.
Okay.
So yeah.
How do you get somebody to eat during the day so that they don't go hours without eating? Like my husband does at work. I mean, he'll eat his lunch, but he goes in early at 7, doesn't get home till 5:30. So he has 2 meals a day. And
yes.
I think
it's impossible to be. It's impossible to be happy during that time.
That's right.
Yeah. So, what type of work does he do?
Inside sales. So he's at the desk, the telephone, the computers all day long. A lot of pressure.
Okay.
From
He can't have anything in his drawer, like nuts
and
or.
I could talk him into it. He's just not in that habit of eating anything.
Yeah.
In between meals. He just does never snacks in between meals.
No,
He just
no.
doesn't do it.
Yeah. So I mean, if he wants to feel happier.
Maybe I just put it like
Yeah, but obviously, yeah. I mean, you can't force anyone to be happy.
Well, because we're not happy, but we're not him.
Exactly. Some people just don't want to be happy.
No, I guess not.
Then a nutrient that obviously is that we get from the sun. It's a vitamin, but it's actually more of a hormone, and that's vitamin D3. And during this time of the year, I usually suggest at least 5,000 IU of vitamin D3 a day. And some people that are really deficient, they need like 10,000 IU of vitamin D3. And do that for like a short period of time to 10,000 and then go back to the 5,000. But vitamin D3 has a huge impact on how you feel emotionally. And also, in addition to that, it actually has a huge impact on pain. So for somebody that's inflamed or have pain in certain areas, then by adding vitamin D3 in large quantities, and I can have patients that within a week, pain is just gone. So it's just one of those very cheap and very effective pain relievers. But it works great also on your mood, how you feel.